Good afternoon, ladies and gentlemen. My name is Joanna Drake. I am the Deputy Director General of the DG Research and Innovation, but I'm also having the privilege of managing the mission on cancer. I'm even more privileged to be here with you today, together with very, very learned and experienced colleagues on the topic of cancer, who are helping us along in order to create ecosystems. Well, this is the subject for today: developing science to policy ecosystem for cancer control. It's a mouthful, but it actually is really important for policy development. How can we create a system that, by bringing evidence to the fore, actually develops new and improved policies, all in order to control cancer better? And don't we all want that? Equally, we shall be talking about the mission on cancer, which I have already referred to, with activities happening at the national, at the regional, and also at the federal levels, at the local levels. Because if the mission cancer is on its own, it will not work. It has to work in an integrated manner with the activities happening on the ground. We'll also be having a look at mission hubs. As you may know, in order to foster this integration, the Commission has included in its work programme in Horizon Europe a coordination and support action to establish national cancer mission hubs. They will play a very crucial role in this coordination with member states, with the activities that are organised at the local and regional level, but also to reach out to the relevant actors at the national, regional and local research and innovation, together with health systems. They will generate and leverage synergies also with, I'm sure you've heard about the Europe Beating Cancer Plan, with which we have been complementing each other very much in the field of action, but also hoping to reach the objectives and the impacts on the ground. I'm looking forward to this session. I'm confident that with our exchanges, we will highlight very concrete approaches and practices in both policy development, but also in the aspects relating to governance and resource mobilization to tackle cancer. And you are going to have a role to play here, because you will not only be listening to us and seeing our learned panel members, but also you'll be very axiomatic to provide us with ideas in order to make this ecosystem work and in order to underpin the development of policies to control cancer. Why? Because we all want solutions to overcome these challenges. But before I welcome our panelists, I would like to emphasize that we are counting on your participation. You are very much invited to share your views on Slido. I will be prompting you for that. But be prepared by accessing Slido already now, in order not to have technical difficulties later, in order to give us your ideas. But there's one big but. Your ideas have to come in one word on the questions I will be asking the panelists. But first, I will now go to the panelists, and I'll introduce them one by one. Professor Véronique Trier-Lenoir. She's a member of the European Parliament, and she has been responsible for the report on the Special Committee on Beating Cancer. So welcome, Professor Véronique Trier-Lenoir. We have...
Hello, everybody.
Hello. Dr. Eva Claudia Lang. She is the director at the Austrian Ministry of Social Affairs, Healthcare and Consumer Protection. Hello, Dr. Lang.
Hello. Hello, nice to meet you.
Professor Rosario Perena Abellón. She's the Subdirector General at Carlos III Health Institute. Hello, Professor Rosario.
Hello, nice to be here.
Nice to be here. And finally, but definitely not least, here in the studio with me, I have Professor Walter Ricciardi, who is the chair of the Cancer Mission Board and Professor of Hygiene and Public Health at the Università Cattolica del Sacro Cuore in Rome. I'm very, very grateful for your participation today. As I said, your knowledge and experience will not only today inspire us and inspire the audience, but also have been already strong assets all along this trajectory that we're all following. So let's kick off the first part of the session. We don't have much time, so we really have to be very, very disciplined on the time. So The first part is, in 3 minutes, I would like to have your views on what, in your view, are the enablers to develop a science to policy ecosystem at national level. And I'm going to start with you, Professor Trier-Lenoir. You were, very much like the conceptualizer because of the report from the European Parliament, and you have been very instrumental for the adoption of this report by the Parliament in order to strengthen Europe's fight against cancer. Perhaps in 3 minutes, can you please highlight the main elements of this report related to this topic? Floor is yours.
Thank you, and thank you for the challenge. It is really an honor for me to represent here the European Parliament during your Research and Innovation Days. I will try to introduce the Becker Report's recommendation on how to implement the EU beating cancer plan at the national level and on the field of research and innovation. Of course, research and innovation are one of the main tools to fight against cancer, and we have taken this into account in our work. Understanding the causes of cancer, detecting earlier, treating more effectively, will help us find the goal, that is to reduce premature mortality from cancer by 1/3 by 2030. And we will all, of course, count on you, dear Professor Riccardi, and on the support of the Cancer Mission to achieve this goal. In our opinion, we must make every effort to first multiply research programs, pool and share knowledge, promote multidisciplinary national and above all European and international cooperations, and develop the mobility of our researchers and students. We want to guarantee rapid access to independent and non-profit clinical trial for research and for all patients, children, adults, elderly, vulnerable and underrepresented populations in close collaboration with both the patients and the patients' associations and the consumers' associations. Money is, of course, the sinews of war. We need reinforced and sustainable fundings to develop cancer research. Of course, we appreciate the effort of you, Joanna, and our dear Commissioner, Maria Gabriel, to provide the Cancer Mission of Horizon Europe with a significant budget, 4 billion euros, but we will also count on Digital Europe funds to boost the use of artificial intelligence on big data. We will need to provide we will need to encourage private-public partnerships, providing they are transparent and driven by health needs, public health needs. We want to address unmet needs with a specific focus on cancer poorly investigated causes, mainly environmental, and more than ever, encourage research into treatments for rare, complex, and poorly curable cancers. To finish with, the message is clear that collaboration is key. We welcome the network of comprehensive cancer centers because we have to boost common research initiatives from reference centers. And in our report, we also propose to facilitate the networking of the existing 27 national cancer control programs with the proposal of a virtual cancer institute for European cancer.
Thank you very much.
3 minutes were enough to tell you.
It's a bit more than 3 minutes, but yes, I understood that you really tried your best. I know that it's not easy when you're dealing with such complex issues, but unfortunately we have time running against us. So thank you so much for your collaboration. So I now turn to you, Dr. Lang. You are sitting in Austria. We had the privilege also to meet you in one of our visits in Austria, and you know you're very active. Can you tell us a little bit more about your Austrian experience?
Yes, thank you for the kind invitation. It's an honor being here. The Austrian governance offers a frame for designing and implementing the mission and ensures cooperation of all involved institutions and society. We are using different instruments. We do have the research, technology and innovation strategy of the federal government that defines the overall aims. And we do have an agreement that defines the strategic research priority for 3 years. The structure of the national governance consists of 2 coordination groups involving research and innovation institutions and the responsible ministries, and it's acting as interface between all participants, supporting regional, local cooperation and politics. An important role plays the mission action group that supports the implementation. The group worked out recommendation on design and implementation of the mission. It identifies success and bottlenecks, analyzes the need of research and innovation, and involves interested citizens. There is also a focus on strengthening the local and regional cooperation and the cooperation with all relevant players in society. The group consists of representatives of science, industry, clinicians, care, patient representatives, and the ministries of health and education, science, and research. The group worked out already a recommendation for a successful implementation. We also do have 2 advisory boards on foresight and citizens and 1 on strategic intelligence. These 2 advisory boards will now be replaced, so it's planned to replace them by a mission facility covering all these aspects. Also, 2 studies have been conducted so far, a baseline study on the status quo of research and innovation in Austria, and 1 on funding. With regard to funding, it was stated that Austria has a high funding level in the international context, but nevertheless a mission-oriented funding has to be improved. The next steps are commitments of all responsible ministries and the central research institutions on the implementation of the mission cancers are made. That's in process. And for November, a commitment of the Austrian government about the implementation of the missions is in preparation. Also, the next steps for 2023 is that it's foreseen to develop a concrete action plan for implementation.
Thank you very much, Dr. Lang. That was extremely clear, and thank you for sharing that with us. I pass now the floor to Professor Perona Bellon, and I know that Spain has had a very interesting experience in setting up mirror groups, and I know that you have been very much at the core of this activity. Can you share your experience on this as well?
Yeah, thank you for the invitation and for having me here. Yes, in the Ministry of Science created in 2019 the Mirror Group for Cancer, the Mission Cancer, and this is being and collaborates with the Mission Board and assemblies in the different activities. The core, the Mirror Group has a core that is driven mainly by our institution, Instituto de Salud Carlos III, but also is gathering other ministries like the Ministry of Health, and also organization and networks in working in research in oncology, also 2 different comprehensive cancer centers in Spain, and also centers for development of technology and innovation, because it's one of the things that we want to do, like Marta Gomez Quintanilla is one of our members. This Mirror Group has been enlarged up to almost 30 new members now. That includes scientific policy agencies, health policy agencies, different funding agencies, industry, and patient organization, and other national government organization. we have been active in supporting the member of the Miro groups in presenting CSA actions. For one of them has been already funded for the European Initiative to Understand Cancer, and the other we have already applied, is still not decided, on the establishing of cancer mission hubs, which is very interesting for us, and we have been contributing together with our members of the Miro group and ourselves. In the managing of cancer and funding, we are a funding agency, the Ministry of Health, and we have 3 sub-agencies working on that. One of the is Instituto Salud Carlos III, which is biomedical funding on cancer research, the Agency of Investigation, which is mostly basic cancer research, and the CDTI, which is implementing the collaboration with industry and financing industry project and mixed project. We are now improving in those have mixed calls for industry and basic science or hospitals, trying to keep this gap between the basic and translating to the patient all the discoveries and to the industry, and try to implement that on the hospital, the day-to-day treatment of cancer in the hospitals. And this has been very well with the help of hospital network, other institutions, centers focusing on cancer, like that are under the umbrella of the Ministry of Science. And we are very excited about this and trying to release support already with the help of the EU Next Generation funds that we have applied to this funding of this for cancer research and innovation. And I think we are making a nice job trying to improve every day, but still there are a lot of things to be done, like collaboration with other missions in developing this.
Thank you.
Global.
Thank you. Thank you very much, Professor Perona. I now pass on to Professor Ricciardi. And we have been talking about cancer control. This is why we are here. We're trying to create policies to control better, meaning that also to prevent. But I would like to have your views. You know, what is the stakeholder involvement there? What is the impact that they could have? What are your views on this?
I think it's of paramount importance that all stakeholders are involved. And honestly speaking, in the first part of our work in the past 3 years, we felt the support by all stakeholders. Of course, the European Commission, we thank for that, the European Parliament, scientists, professionals, citizens. We had a lot of work together with citizens in different countries. So the preparation phase is universally accepted as the best possible option now. The problem is to enforce it, is to implement it, as Commissioner Gabriel encouraged us to do earlier this morning. And now the challenges are much more important because we have to align the different incentives from the European perspective to national one. I congratulate Austria and Spain. They can be considered benchmark for this, but unfortunately not all the countries have up to now followed the same path. We encourage to do that because I think it's important to coordinate and to align the incentives. Otherwise, we will not be able to deliver. And this kind of collaboration is even more important because in the past 2 years, the world has dramatically changed. The world is in turmoil. I mean, not to mention climate change, but pandemic, the war in Ukraine, the inflation crisis, the energy prices, which are strongly affecting also the healthcare sectors, are challenges that we have to face together. And we have to create really this ecosystem to tackle these challenges. One last request for the politics, for this harmonization between science and politics, is support us, please, in the speeding up of the digital transformation. And digital transformation in particular has a limit in Europe, which is related to the fact that the European health data space at the moment lacks interoperability, but moreover lacks the possibility to use the data at the best option. So look at the GDPR, look at the meaning of the GDPR, which is to protect the health of the citizens, of course, respecting the privacy, but not only the privacy.
Thank you, Professor Ricciardi. I also congratulate you because you were very concise and to the point, and you basically made up for some other time that we had before. We have actually quite a number of elements now already to deal with, and it has already, I'm sure, provoked a lot of thoughts and ideas in your mind. And now I turn you to the audience, and as I promised at the beginning, and we would like you via Slido to indicate any other enablers to develop a science to policy ecosystem. You've heard the experts, you've heard the people who have been really like in the thick of it, both from the parliament, at the national level, health and research and innovation systems, universities at the level of the mission board at the EU. But you know, you are the audience, you are interested in the subject matter, you could be stakeholders, you could be just common citizens, maybe also cancer patients or people have touched with cancer. And you might have your idea of what we need to do in order to have these enablers. Professor Ricciardi mentioned the important point of digital, for instance, and looking at the data aspects. Why? Because I think data is something that in this case definitely very, very, very personal, but at the same time, we need it in order to improve policy. So we need to have a system that actually blesses nearly the transmission of data to the appropriate sources, to the appropriate authorities, obviously with full respect it requires, but at the same time, that it actually influences good policy making. We've heard other points regarding how the mirror groups, for instance, is, as Professor Ricciardi as well said, and Professor Abeillon detailed to us, a complex structure seemingly, but it's something that needs to be done in order to make the machine oiled up and working in order to really address the mission that we have on our minds. And then, of course, from Dr. Lang, we saw how detailed the plan and the commitment of various heads of government and also stakeholders and research institutes who came together to make a common plan and a common commitment, with the next steps being very, very clear. And of course, from the rapporteur herself, we saw what the intentions were from the assembly of the people, if you like, within the institutional setup of the European, of the EU, and the co-legislator who wants to really make sure that, as Professor Ricciardi said, let's enforce it, as Commissioner Gabriel also said this morning. But now I hope that you've had the opportunity, dear members of the audience, to in one word, give us a little bit of your ideas as well. But now let's move on to the second part of our session. I already mentioned the main elements, but I would like now to turn to you in the 22 minutes that we have left. And maybe I'll start with Professor Ricciardi this time, and we'll go in the opposite direction, anti-clockwise. What are your views on the points that have been brought up already? I mean, there are many things that we could talk about, but I'm intrigued by a lot of them. You mentioned the idea of the benchmark. Now, every ecosystem is going to be a different one. We cannot have an ecosystem that's actually repeatable, but it's something that can actually be emulated and adapted. What is going to be the incentive for that? You know, what is going to make a government organize themselves together with the different elements who are, I'm sure, very active on cancer, but what is going to incentivize this? But of course, don't only feel obliged to answer this question, react to any parts of the interventions.
I think that, first of all, we have to share not one, but two polar stars. And this, of course, we give for granted, but it's better to be explicit. The polar stars are scientific evidence, so we have to rely our decision-making on science. And in times of infodemic and fake news, this is not granted. So sometimes we have to fight for it. And the second is the interest of citizens. So if we align the incentives around these two polar stars, I think the mission can be accomplished. But of course, this is not easy everywhere. There are different cultural, social, economic, political sensitivities. But if we align us with the polar stars of scientific evidence and interests of citizens, I think we can align the incentives. And the incentives can be aligned with the practice that Austria and Spain have shown us. So mirror group, coordinating the activities, trying to essentially put in contact immediately the result of the board with the result that government have to make at the local level. I am very optimistic, but of course we have to be very explicit on this, scientific evidence and interest of citizens.
Thank you very much, Professor Ricciardi. I turn now to Professor Barola, Abeyon, and you mentioned the various elements that you put together, the various dots that you joined up. And I really congratulate you for that. And I really hope that other member states and other communities who are listening to us maybe today actually are really inspired by you. And I hope you'll be inundated with a lot of requests of how you did it. Maybe you could have a guidebook on that as well and a few guidelines of how to do it. But I want you to tell us, some of the difficulties that you've had, and therefore not to be naive about this, and what you could already tell us what you learned from this process so that others do not make the same mistakes.
Yeah, thank you. One of the things that we have made is trying to get more resources, and a lot of effort has been incorporating the patients in our boards for evaluating. So trying to listen to them, to their interested, to their in cancer, and sometimes with other pathologies also. But it has been a very nice and constructive collaboration with the patients' organization, also with the private organizations that are in charge of financing cancer. The collaboration with them has been very fluid, and also trying to implement has not been easy, but we try to implement those basic industrial calls to try to put all things together. I think this was new for us, but I think it's a success. It will be a success in trying to get the things that have been in the labs or in the hospitals to the benchmark and try for new indication for patients to make a more personal medicine. So this is something that requires effort, but I think it's worthwhile to do it.
Absolutely. May I ask a supplementary question on this? I mean, I'm very much intrigued by citizens' engagement when it comes to cancer, because cancer is a very personal problem, either because it has affected you as a patient or the people around you, the people you love, the people who are your friends or are in the community. How did you ensure that?
We involve them, the patients' organization, in the evaluation of the projects. So that makes them come to reality, to like clinical trials, new clinical trials, for example, in CAR T cells, using them, making them involved in looking all the process and trying to make them to understand the new evidences and the new treatments that we are working, that all this science that is made in the hospitals can be translated to them. And this has been actually in the Instituto Carlos III, we receive a prize for that.
Okay.
Because it has been very interesting. We teach them how to do it, but this is very useful for us.
Thank you very much for that. Dr. Lang, again, you were in the thick of it in Austria. What would be the advice to those who are trying to, from scratch, setting up an ecosystem? They have the elements, but they need to join up. You spoke about a common plan. You spoke about a common commitment, budget, really sensitive point. What advice would you give? But any other reaction, of course, on what we've been talking about, you're welcome to share it with us now.
Yes, thank you. Yes, it's a strong effort. I must say, in Austria, the leading ministry for Horizon Europe and the missions is the Ministry of Education, Science and Research. And this ministry took the lead very successfully, and together with the other ministries and the central research institutions, we began from the very start to work together, to cooperate. We worked out a clear structure all together, on an equal level. And I think this intense preparation before the start of the missions was one of the way of success, that we are now in a strong position to have already a clear structure and the different working groups and mandates, terms of reference for the working groups, and that we started from the very beginning to involve all participants along dealing with cancer.
Thank you very much, Dr. Lang. I turn now to you, Professor Trier-Lenoir. I need to make sure I get it right. You have been telling us about the objective, and the objective is, of course, something that needs to be measured. You said a third. We need to reduce a third of the mortality of cancer by 2030. And you've heard, from, I would say, the front runners, what is being done in the member states. You've also heard the chair of the mission, Cancer Mission Board, telling us, these are the polar stars we need to stick to. Are you satisfied that we're going in the right direction? 2030 is like tomorrow. Do you think we'll get there fast enough?
If I have 1 minute left, I have one take-home message. From what I have been hearing for about 40 minutes, the conclusion is clearly that, okay, we have the money from the Commission, and money is the sinews of war, but money is not the only issue. The main issue is the political will of the member states. Without a political will, even the Commission will not be able to implement its cancer plan. What we hear is a will, an individual one. What we need is to be stronger together and activate cooperation, collaboration, common standards in order to do better at the European level. And I won't be too long this time, but this is my take-home message: stronger together.
Thank you very much, Professor Trier-Lenoir. Actually, we have more minutes for you coming up, because now is the time when we can look at the one words that we asked from the audience. And we asked them for one word feedback, some reactions, and I'm sure you can look, I hope you can look at the screens and have a look at the words. So we've got words like knowledge transfer, stakeholder involvement, cooperation, public-private partnership, not a research mission, all stakeholders on board, transparency, biobank, prevention, regional authorities, harmonization, pooling resources, translation R&I results, new knowledge, cross-policy approach, public investment, municipalities. Who coordinates? Key question. Data sharing, multidisciplinary engaged scientists. Okay. And now we have exactly a bit less than 12 minutes left. So we have a bit of time to go around again the panel and give us a bit your reactions. What thoughts do these words trigger from our audience? I do agree very much with Professor Trier-Lenoir about money not being goal. I'm a big believer on that. It's much more than that. And political will, however, needs somehow to be cajoled, if you like, as well. And I think what's been happening here is a constant, I would say, effort to cajole. But really, I would like to hear your reactions. You have 2 minutes each, I would say, and then maybe a last message after that. So, who would like to start? Professor Trier-Lenoir, would you like to start?
Okay, I'm happy to have some time left.
Absolutely.
It's good news. It will be not enough, but it's good news. Thank you. Well, I will stick to my line. Most of the points from the European Beating Cancer Plan are recommendations, not legislative texts. When you are in front of recommendation, you very well know, madam, that we have to be incentive and to make sure that the cooperation is ongoing. This is why, again, to take the very good example of data sharing, even if all the European member states are not at the same level of capacity and competence on data sharing, only a common political will help to share knowledge, share data, use each RGPD as it should be used for research. And again, the solution to many obstacles are in the capacity of the member states to do together. Professor Lang, sorry, I can't remember the name of the Spanish professor. Please make
Perrona
sure.
Abegon.
Yes, sorry, but I could not,
Problem.
remember her name. Please make sure that the Council takes into account the recommendations and implement them.
Thank you very much for those reactions. May I ask Dr. Lang?
Yes, thank you. I support all the statements. And to reach the goal, a successful interplay and cooperation between all partners is essential. In Austria, we are keen on to involve all necessary players and to create a strong network. Cancer causes so much pain and sorrow each day for patients and their families. And Austria is willing to undertake all efforts to make a contribution to the EU-wide approach to reach the goals of the Mission Cancer.
Thank you very much, Dr. Lang. Professor Perrona Abegon, what would what are the words that have struck you most from the Slido?
The data sharing and the together we can construct and share this data, and this data can be reused for other purposes with other groups. We actually have a infrastructure for personalized medicine here for data and genomics, and we make all our calls have the interoperability of data and to release this data for use of inside our country and with other researchers to try to get the maximum products of this research that is made. So I think this is one way to go. And actually we are collaborating with other like 1 Million Genomes and other European infrastructures to get to that. We have to get interoperability of the data to be able to use all this data and all these resources for the benefit of patients.
Thank you very much for that. I mean, I know also, Professor Richard, you also mentioned data interoperability, but I would like you also to have your pick of some of the words that have been kindly shared from our audience, but also perhaps maybe because there's the audience there and maybe they're saying, but what do they mean by interoperability of data? What are the benefits? How are we going to benefit when you weigh that against data privacy? Maybe you could, in a couple of sentences, explain why this is important and what are the benefits of that.
I'm fully aligned with the consideration that the colleagues of the panel did, in particular with Professor Trillet-Lenoir remarks about political willingness. Today, we in Europe do not have a technical problem. I mean, technology is here. We can solve the problem of interoperability, giving the member states the possibility to keep their information as it is, but because the cloud, the system. The problem is that, and I'm impressed by what the audience said, I mean, the key words are harmonization, data sharing, integrated approach, cooperation, which means that people have understood that at this level, it's the only possibility for giving them a solution, because we are one of the most unequal part of the world, where it's difficult for some citizens to have access not to advanced science, but in some cases to basic science in solving their problem. So we have really to fight, and I understand this is a very tough word, but keeping government accountable if they don't meet the expectation of the patients that feel sorrow and pain. And just to give an example, from 2007 there was a resolution by the Council of Europe concerning cancer screening, and there are some countries that still don't have a national public funded cancer screening program. I mean, shouldn't we take these politicians accountable for the lack of willingness that means the difference between life and death, because a woman that is in these countries means that has a higher probability of dying of breast cancer or colon cancer. I think we have to act as an incentive, but also as a kind of, accountability. Accountability is a key word. And I understand that the people have understood that and they reclaim for that.
So in other words, you are saying that not only have people understood that more science needs to influence policy, but also that we need to share data more, which is even at a personal level. In the same way, by the way, that member states have agreements to share banking data to prevent fraud. I mean, we're here talking about health, personal health, the longevity of the human race itself. And at this age, when, as you say, we have no technological seamless issues, between European countries at least, but so much science and so much research, but that I'm sure that a lot more impact could actually be achieved. Even if we think about the objectives of the mission of cancer itself, which is preventing, which is giving a better life for those who have been affected by cancer and having more of a future if you're a young cancer patient survivor, for instance. So, this is understood. So obviously it's the political class that needs to also move. By the way, mentioning the political class, that we have adopted the renewed recommendations as a result of science advice for screening, for screening of cancer, for different types of cancers, for 3 different types. And I think that has been the automatic, if you like, result of science, making recommendations to policymakers. So I think that's a good example that could be followed and hopefully serving a benchmark also for other areas. But we still have, believe it or not, some time left. 3 minutes, 20 seconds. I invite you to make your concluding remarks now and the very strong messages which is going to move that mountain in other member states where they have not moved yet, whether it's political will, whether it's because there isn't enough resources, whether it's because the research people and the health people don't talk to each other. How are we going to move them? What's going to be your real big bellowed out message for them? And I'll start with Dr. Lang this time, because she has been really very, very astute with her plan in Austria, and I'm sure we'll have results.
Yeah, thank you. I can also all invite join this important mission, Cancer. Give all efforts to save lives in the future and also improve the quality of life. For us in Austria, it's important to cover all aspects from understanding cancer up to improve the quality of life. And I think all together and with appropriate funding in the member states, we will make it. We are on a good way.
Thank you. I hope that that will influence a lot of the member states, governments and working parties. Professor Perona.
I will encourage the authorities of the different ministers involved in the financing of cancer to try to make plans to enforce collaboration among the different players, even the patients with the institutions, to try to get a better results and enforce the projects to be useful for this regeneration of new data and to get to the patient. And really, I think from the government, by modeling the calls, the funding calls, and making more funding, making the EU resources for that would be much better for the patients and in general, for the population.
Thank you very much. Professor Thierry Lenoir, you have even more time.
I take the strong risk to be a little bit chauvinistic. We have had 15 years of cancer plans in France, and these cancer plans are not perfect, but they are robust. Why are they robust? Because they were asked for, thought, and elaborated by the patients and the citizens. The the solution for a cancer plan to be effective is
We have to conclude soon.
Driven
20
by
seconds.
Thank you.
Thank you so much for this. Professor Ricciardi, 2 words.
A call to politicians, invest more in health. A call to citizens, invest more in your health and invest in something which is around the citizen and around the patient.
Thank you very much to all. Thank you also for the audience. Goodbye.